My topic is effect of hydrogen sulfide on urinary function in rat with cyclophosphamide-induced cystitis. We have nothing to disclose. Cyclophosphamide (CYP) is a chemotherapeutic drug. Well, one of its adverse effects is the development of severe hemorrhagic cystitis, which induce bladder inflammation, pelvic pain, and diffuser overactivity. These symptoms seriously affect the treatment tolerance of chemotherapy and the prognosis of patients. Moreover, there is currently no lasting and effective treatment for most patients with these side effects. Therefore, critical approaches for preventing CYP-induced cystitis are urgently needed. Hydrogen sulfide, H2S, is recognized as an endogenous cancer transmitter, and it has a wide range of biological functions such as anti-inflammation, antioxidation, and cytoprotection. Moreover, H2S is believed to play an important role in formulation of visceral pain. Therefore, H2S might be a promising therapeutic target for CYP-induced cystitis to improve tolerability of chemotherapy with CYP. Therefore, in this study, we investigated effect of pretreatment with H2S on bladder dysfunction of CYP-induced cystitis in rats. This slide shows the experimental schedule of this study. Male Vista rats were divided into 4 groups. Rats were pre-treated with saline or NaHS and H2S donor at a dose of 3 or 10 micromole per kilogram once daily for 1 week before the experiment. CYP at a dose of 150 mg per kilogram or saline had been injected 2 days before the experiment. After 1 week's pre-treatment, continuous cystimetry was performed. I will show you a result. CYP injection significantly decreased the body weight and increased the bladder weight and the bladder body weight ratio (BBR). Pre-treatment with NaHS at both doses of 3 and 10 micromole per kilogram showed no significant effect on the CYP-induced changes. This slide shows a representative chart of continuous cystimetry obtained from each group. In a vehicle pre-treated CYP group, the intercontraction intervals (ICI) was decreased, and the number of non-voiding contractions was increased compared to the vehicle pre-treated saline group. In the CYP group pre-treated with NaHS at 3 micromole per kilogram, the number of NVC was decreased compared to the vehicle pre-treated CYP group. Moreover, in the CYP group pre-treated with NaHS at 10 micromole per kilogram, ICI was increased, and the number of NVC was decreased compared to the vehicle pre-treated CYP group. This table shows quantitative data of continuous cystimetry. The vehicle pre-treated CYP group, ICI and bladder compliance were significantly decreased, and the number of MVC was significantly increased compared with vehicle pretreated saline group. NIHS pretreatment at each dose significantly improved these CYP-induced increases in the number of MVC. Moreover, NIHS pretreatment at a dose of 10 micromole per kilogram also attenuated CYP-induced decreases in ICI and bladder compliance. And we don't show the data today, but there was no significant difference in post-voided residual volume among these four groups. These results indicate that NIHS pretreatment could suppress the CYP-induced diffuser overactivity and improve the urinary frequency and bladder distensibility in CYP-treated rats. In conclusion, pretreatment with NIHS at a dose of 10 micromole per kilogram may have a protective effect on CYP-induced bladder dysfunction. Therefore, H2S pretreatment might be useful for prevention of CYP-induced urinary side effects during chemotherapy. That's all. Thank you for your attention.